Good evening, everybody. It's Mike Britt, Ohio Chapter President of the Farmer Veteran Coalition. And we are here this evening with Catelyn Turner, Extension Educator from OSU down in Monroe County. And before I turn it over to her and her presentation on tick-borne diseases, I'll give you a few updates of what's going on with the chapter. So as far as webinars coming up in June, we will have a farm safety webinar hosted by Seth Coakley of Howell Rescue Systems in the West Licking Fire District. And in July, we are working on getting a presentation on beekeeping. Still got to finalize that presenter. August, we are not going to have a webinar that month because we are going to have our in-person workshop. Currently, we think we got most of it locked in. And it will be held at the Eastern Agricultural Research Station in Caldwell, Ohio at OSU. And topics will be on cattle and sheep. So that is coming along, and stay tuned to our webpage, social media, and we will continue to provide you updates on person workshop in August. And then let's see here, annual meeting. 14 November. It is in North Central Ohio, up in Fulton County. So in the morning, we will be holding a farm tour of the Bracy Gold Bison Ranch in Swanton, Ohio. And then in the afternoon, we will meet at the Fulton County Soil and Water Conservation District in Wauseon. And the presentations, the educational part there will be on business plans and farm financials to try to get you ready for next year's 2027 fellowship grant, and maybe review some of the things and provide you some tips on how to better your application. And just one other update, the Ohio chapter did receive a grant through the Honda Foundation grant and Rural Action to promote agroforestry here in Ohio. And we were awarded $5,000 to put on workshops, 4 in-person workshops, and $1,800 in scholarship funds to send FVC members to other conferences. So we've already held 2 workshops, and our next one's not coming up to October at the, let's see here, was a Route 9 Chestnut Cooperative in Carrollton, Ohio on 3 October. And I believe that is all the updates we have right now. Also be on the lookout for a posting on the website and social media regarding travel stipends to the national conference. This year it's being held in Williamsburg, Virginia, celebrating the nation's 250th birthday. And the Ohio chapter will select applicants for a $750 stipend. So that should pay for your conference, your hotel, and probably most of your travel if you are driving. So with all that said, I will turn it over to Catelyn Turner.
Thank you. Good evening, everyone. My name is Catelyn Turner. I'm the Agriculture and Natural Resource Educator for Ohio State University Extension in Monroe County, so Southeast Ohio. I want to preface this presentation with the fact that I am not a veterinarian or a doctor, and that I can't give medical advice for the tick-borne diseases that will be mentioned in this presentation. I just want to provide you with the facts and the knowledge on how to identify ticks, be aware of the diseases they can vector, and how to protect yourself from contracting any of these diseases. So some of the ticks that we have here in Ohio, you see pictured here. You can see they range in size depending on their life cycle, and they can be very small, so they're very hard to see. We have the American dog tick, the black-legged tick, the Lone Star tick, the Gulf Coast tick, and the longhorn tick. So we have a few myths associated with ticks that we hear quite frequently. Myth number 1, being that ticks are only active in the summertime. That's not true. They can take 1 to 3 years to complete their life cycle. So depending on what species they are active all year long. Myth number 2, they prefer the woods. Some species, such as the American dog tick and the Gulf Coast tick, we have found actually prefer habitats such as open pastures and fields. And then myth number 3 is it takes 1 day to transmit a disease. So as data is coming out, we are finding that this is not always true. It doesn't take a full 24 hours for some diseases. Those transmission times will vary depending on the tick, depending on its species, what life cycle stage it is, and also what disease that they are vectoring. So this is why it's so important that we do tick checks on ourselves after being outside, or checking our livestock or our companion animals, because some of these diseases don't need that full day to transmit. So we'll go more into that later on in the presentation. So talking about the life cycle of ticks, like I said, they can last upwards of 2 to 3 years. So they consist of the following 4 stages. We have the eggs, the larva, the nymph, and the adult. So in order to progress to that next stage, ticks must successfully feed on a host. We also call this having a blood meal. So ticks are able to find their hosts by hitchhiking. As you can see in the picture, the little guy in the bottom corner, they will climb up on tall grasses, low-lying brush, extend those legs out, and just wait on their next host to walk by. So tick eggs are often laid in the spring. After those female ticks have completed that 2 to 3 year lifespan, the eggs can be brown to red in color, and they're usually translucent. One tick can lay thousands of eggs. So while these ticks have to detach from their host before they can lay their eggs, we will usually find eggs under leaf litter, brush, any of those soft, warm places outside. In the summer, these tick eggs will hatch, and then they are in that 6-legged larva stage. When the larvae are finished feeding on their first host, they'll fall to the ground and they will transition into the next life cycle stage called nymphs. Between the fall and spring, larvae will molt into those nymphs, and at this stage, they will now have 8 legs, which will put them in the arachnid family. So during the fall, when the nymph falls off its host and transitions into adult, this is when it's going to look for that 3rd and final host to complete that life cycle before they become mature enough to lay eggs and start the whole cycle over again. So first, we're going to talk about the American dog tick. They are larger in size. They can be easily recognized by their brown and red dotted bodies and these elaborate dorsal shields that we see. So the American dog tick favors environments in brushes, open pathways in forests, and we also find them in a lot of open areas where tree cover is limited. You can see in the picture of the state of Ohio, the light blue counties are the ones that have reported 1 to 5 ticks within the same year. We're currently sitting at 5 counties there, with the rest of the state having established populations. As you can see from the map of the United States, they're pretty much well across everywhere except for the center in those western states. The next tick we're going to talk about is the black-legged tick. So these are also called deer ticks. They are relatively smaller at all their life stages than any of the other medically important ticks that we talk about. The backs of the adult male ticks, as you can see pictured above, are uniformly covered by a dark brown shield or scutum. But as we can see on the female, it only partially covers the back. The females tend to have that red-orange body, and after the females have taken a blood meal, they can become as large as like the eraser on a number 2 pencil. And they will usually have that grayish appearance that we are familiar with. The black-legged tick is the one that's best known for transmitting the Lyme disease. As I mentioned in the slide with the myths, ticks are active all year long. We just tend to be more aware of them when their numbers are larger during these warmer months after those thousands of eggs have hatched. As you can see in that dotted green line, that's the little larva. They're usually active after they've hatched, starting in May to June, going through those hot summer months to August. So that's when we see a lot of activity from them. But they're active all year long, just depending on what stage of life they're in. So these charts kind of reflect that. The highest cases of Lyme disease are being reported during those warmer months, but ticks are still active all year long. So over the last 14 years, there's been a 48-fold increase in Lyme disease cases reported in Ohio. This top chart shows that those numbers are higher in younger children and teenagers due to their increased exposure. They, tend to play outside more during those summer months. So this is all the more reason to do those frequent tick checks on yourself, on your kids, just to make sure that we are staying ahead, because tick-borne diseases are preventative diseases, and we do that by doing tick checks and preventing them from biting us. I thought this was quite funny because it's true. I had a class with kindergartners this morning discussing tick habitats and how to protect ourselves, and one of them asked, so we're in their home? And it made me think of this reel I had saw on Facebook, because a lot of us, we do have the same taste and scenery as ticks. We like to be out. We like to be out in the woods. We like to be outdoors in the hayfields. And that's usually where we will find a lot of these populations. As of now, 10 counties have reported and identified black-legged ticks in them, with all the rest of the state having established populations except for Putnam County. I had a program earlier this spring on ticks, and a man in the audience said he knew why they didn't have any. So we were all like, why? And he said they had put up signs. So the audience got a kind of a nice laugh out of that, but it just shows that the importance of sending ticks in for identification. If we don't get any ticks sent in that can be positively identified as black-legged ticks or any of the other ticks we're going to talk about, then there's no data saying they're there. So the more ticks that are sent in by the public, the more data we have that we can work with so that we can understand where they are, which diseases they are transmitting, and kind of follow their patterns. So the picture on the right, it shows Lyme disease cases within the state. The colors of the counties are from the years 2015 to 2024. So the higher cases are those darker orange ones that we see, if you can kind of see them through the green dots. Excuse me. The green dots are just the cases alone that were reported in 2025. So quite a few green dots on this map. Excuse me. So since this tick is the one that transmits Lyme disease, I wanted to kind of talk a little bit about the symptoms to be aware of. Many of these symptoms are not specific to Lyme disease, and they can be caused by a variety of different factors. However, the erythema migrans rash is often a characteristic of Lyme disease. This is that rash that begins at the site of where the tick bit, and it'll gradually expand. So the center of that rash appears clear, and then it enlarges, kind of giving that appearance of a bullseye or target. The rash usually appears within 7 to 14 days after a tick has bitten. It may be warm, but it's not usually painful or itchy. Just know that while this rash is commonly associated with Lyme disease, not everyone affected with Lyme will develop this rash. So if you suspect that you have any of the symptoms, or you have been in contact with the tick, or you have found a tick on you, consult your doctor for more information for testing. Other symptoms that we can experience could be headaches, fevers, chills, muscle pain. A big one that everyone talks about is joint pain and fatigue. And if gone untreated, it just gradually gets worse. So they usually will typically put patients on antibiotics to kind of jumpstart the treatment of Lyme disease. Next, we're going to talk about the Lone Star tick. So female Lone Star ticks are brown, and they have that single silver white spot on their back that gives them the name the Lone Star tick. The males are brown with white markings on that back plate that you can see at the bottom. Currently, there are 23 counties that have no record of Lone Star tick populations. We have 39 counties that have reported 1 to 5 ticks that have been positively identified. And we have 26 counties that have established populations. So unlike the other US map that we saw earlier, where populations were kind of all over the place, this tick has been pretty much stuck to the eastern portion of the United States. So when we're talking about the Lone Star tick, we're going to have to talk about the alpha-gal syndrome. It is a type of food allergy to mammalian meat, beef, pork, and lamb, that is brought on by the Lone Star tick bite. This allergy is to red meat and other products that come from mammals, and it sometimes can be life-threatening. I've heard various accounts of how this allergy can manifest itself, sometimes in extreme cases. We had one lady participate in one of our programs who said she can't even drive by fast food places because just smelling hamburgers cooking will cause her to have a reaction. So reactions to this syndrome are very, very different. There's a variety of symptoms that people have talked about, a variety of extreme reactions. So it kind of depends on the person. So, we're just still gathering data on what all this means. But as you can see on this US map, the dark blue are the places that have more than 87 suspected cases. So pretty heavily populated across the center of the eastern portion of the US. The next tick we're going to talk about is the Gulf Coast tick. So this tick is small to medium in size, with the adults having that ornate marking on their back, and their bodies are usually a reddish brown color, as we can see in these photos. The Gulf Coast tick reports. So we have 1 to 5 ticks identified, positively identified within 21 counties. We have established populations in 3 counties, and this is more of a passive surveillance. It's not active surveillance. That's why I kind of keep saying, if you find ticks, if you pull a tick off of you, we want to submit them. We want to submit them so that they can get positively identified. We don't have people whose sole job is to go out and scout for ticks. So we want to have as many as we can sent in by the public so that we can gather more and more data so that these maps can stay as up to date as possible. The last tick we're going to talk about is the Asian longhorn tick. You've probably heard of it. It has some unique characteristics. So these ticks can vector multiple pathogens. They also like quite an array of hosts, but they also don't need males to breed. This is also known as parthenogenic reproduction, where the female just makes clones of herself, and a single female can lay up to 2,000 eggs. So that's why when we find these populations, they are usually extremely large populations in a single area. Also, if you look at the picture, the head of the Asian longhorn has these little pointed things on the side of its head. It's hard to see with the naked eye. Microscopic identification is usually necessary to find this, but that's kind of what gives it its name, longhorn. It's similar to the longhorn cattle. So the picture with the lint roller, this was taken in my county. We had done some tick drags when we first suspected finding a population of these Asian longhorns. And it was just thousands and thousands of nymphs. And this is just from her rolling that lint roller down her pant legs. So that's what I mean when I say extremely large populations in a given area. It's not just one or two, it's thousands and thousands. Because if each female can lay 2,000 eggs at a time, imagine if there are thousands of females laying 2,000 eggs at a time and they all hatch. It's just astronomical in numbers. Currently, there are 60 counties that have no record of Asian longhorn ticks. We have 13 counties that have reported identified ticks, and we have 15 counties that have established populations. Those are the dark blue and the ones with the stars as well. So kind of give you an idea of where they all are and how they've moved over the last few years, because it found one on a dog in Gallia. I want to say it was 2019, 2020. And then in 2021, we found that established population in Monroe County. This map gives you an idea of where these ticks are located within the country. Still fairly a new species that we're following, but just in the last few years, it has spread that much across Ohio, from just Gallia and Monroe to the rest. What did I say? The other 15 counties. So we've talked a lot about ticks, but the questions that we get are, how do we control them? So the problem with spraying pasture fields is that these insecticides have to touch the tick to be effective. So in some cases, this is just proven costly. It's not always successful. We have found more success by directly treating cattle and livestock, using those pyrethroid products directly on. Pyrethroids work the best. Carbamates are okay. We can also do things like management intensive grazing, where we're moving cattle, because then you have, a better chance of checking your cattle on a regular basis for those large populations, maybe in their ears, under their tail, on their back. We'll be able to see them better if you look at them more often. There are other options that are being explored right now. We'll talk a little bit more about those in a couple slides. When it comes to your companion animals, there are more options, multiple options, such as like those tick collars, medications. Having that relationship with your vet will help with making those decisions as to which products are best for those companion animals. Livestock, there are multiple options. A lot of them that you can use, they must be labeled for ticks, but you also kind of, if you're going to treat for ticks, I always want to throw in there, partner that with your fly control program. So we talked about the livestock, how to treat those, but what do we do for us? Because we're going to be out in those situations as well when we're dealing with our livestock. So I always recommend wearing permethrin-treated clothing. So you can either purchase it that way, or you can self-treat the clothing and spray it and wear it that way. We want to do regular tick checks. We want to have knowledge of what all ticks are around us. So we have those maps that I showed. We want to check our pets because our pets can bring them in our house, so we want to make sure that we're checking any animals on a regular basis. You can use different types of repellents. A lot of topical options are available, such as DEET, Picardin, IR 3535, and Nucatone. So any of those bug spray repellents that are labeled for ticks, there are some out there right now that say they will kill ticks that carry Lyme disease, so they are labeled for those black-legged ticks. Those are really good options to have on hand as well. Some other control methods for Asian longhorn tick. We want to use integrated tick management by combining surveillance, strategic application of insecticides, and management of cattle movement. Like I said, management intensive grazing, moving our cattle, checking them often. Currently, the Asian longhorn tick doesn't have any acaricides that are labeled for use on them, but there are some that are labeled for American dog tick and Lone Star tick. They should provide beneficial control of the Asian longhorn tick. Like I said, if they have permethrin on them, they have proven successful. A lot of pour-on options that you can use. Just look for that active ingredient of permethrin. We also want to talk a little bit about environmental control. Like I said, spraying isn't always a good option cost-wise and efficiency-wise. So by mowing fields, keeping those habitats shorter can kind of maybe deter them a little bit. And doing some perimeter fencing, we can maybe spray the perimeters, but spraying the whole thing sometimes doesn't seem as efficient. So in regards to stored forages, so we always get the question about ticks being moved from farm to farm, exposing other cattle through hay bales. Can they travel in hay bales? If we have baled hay in a pasture that we know there are current established populations. So they have been doing some studies in progress to determine if these ticks can survive in hay bales. So they put the ticks inside a PVC pipe inside the hay bale to determine if that interior temperature reached high enough temperature to kill the ticks or if they could survive. And so far, it's been determined that they can't survive in those conditions. So, kind of keep an eye out for that ongoing research. But it's looking promising that is not really going to hurt anybody that way. They're just really just moving from cattle to cattle. The white-tailed deer population moves a lot of ticks. So those are more concerning methods than hay bales. So we're going to get in a little bit about some of the diseases that these ticks can carry that might affect our livestock. So a big one that you might be hearing about now is filaria. So these are some of the cities and some of the locations where we've had animals tested. These testings were done in 22 and 2023, but they were all positives everywhere from Monroe, Harrison, Crawford, Harrison, Monroe, Columbiana, Guernsey, Monroe. So with Monroe having that higher population of the Asian longhorn ticks during those years, we had quite a few cattle tested for filaria at that time. So what is filaria? Filaria is a tick-borne protozoan. It will affect the red and white blood cells. So what it does is it can cause anemia. Often it can be mistaken for anaplasmosis due to anemia, lethargy, anorexia, fever, intolerance to exercise, difficulty breathing. Sometimes animals will have a foamy nasal discharge, or we'll see increased incidences of abortions. And then sometimes it'll lead to death. The Asian longhorn ticks that have been sampled have a high percentage of being positive for filaria. So this kind of implicates that these ticks are that transmitter of this pathogen, which is why it's also, again, I'll say this again, it's important if you have ticks, you found a tick, send them in for ID, because then we know where these ticks are and we can further test them to see which diseases they're carrying. So when it comes to the transmission of tularemia, cattle are thought to become infected within 3 weeks of being placed on pastures that contain these ticks that are infected with these vector diseases. Sporozoites, the infective state, are transmitted to susceptible animals during tick feedings through their saliva. So when the ticks bite, they actually regurgitate, and they will mix their saliva with the blood of the animal to create a seal. That's why they don't just fall off easily. You have to pull them out. And during that process is when those diseases are transferred to the host. So regardless of life stage, the Asian longhorn tick can acquire thalaria from feeding, but they found that they are not going to pass that on to their eggs. So each individual tick needs to bite a host that is positive with tularemia. Tularemia mature within the tick after about 48 to 72 hours of attachment. So this is what I was talking about. This is what you can see easily when we have those heavy populations of Asian longhorn ticks. So the damage from feeding that they can cause is they will drain the blood pretty quickly and have higher rates of mortality than any other tick. If they are vectors of tularemia, that animal will also experience anemia, weakness, fever, jaundice, and then eventually death. So when these ticks are first noticed, it was because they took down a full-grown bull. When the farmer found him, his entire ear canals had been filled with these ticks. So it was important to give cattle a once-over. So when we're working with them, we can catch those populations. If we see populations like this on ears, these are more sustainable levels that you can treat before they reach those really high levels that could potentially take a full-grown animal down. So how do we detect it? So careful monitoring is recommended so that we can prevent loss of those animals. Giving them a good once-over. We want to routinely inspect areas that ticks like to feast. Those areas include around the head, the neck, the ears, the flank, the groin, udder, and especially under that tail. So if cattle seem lethargic, we want to closely inspect them for ticks because they could be slowly being drained of their blood supply, causing that lethargy. Identification of the ticks that we find on them is helpful because then we can kind of have a more clear diagnosis of the diseases that are present. So we always want to send those ticks in to laboratory for testing. So if ticks are found on you or your companion animals, knowing how to properly remove them is really important. I prefer the tweezer method. You'll see a lot of other tools that have been created that can get right up to that tick's head and pull them out that way. But I prefer tweezers because you want to pull them straight up. Like I said, when they attach, that regurgitation is how they transmit disease. So if we do anything that would happen to squeeze those ticks, we would be increasing that possibility of transmission. So what you want to do is you want to get the tweezers at their head as close to the skin as you can get. And you want to pull them straight up. We don't want to twist them. We don't want to jerk. We don't want to break any of those mouth parts or the head off in the skin. And then we want to dispose of the tick by killing it. So how we do that, especially if you're going to be sending them away for testing, is you want to get some isopropyl alcohol and put them in it. That'll kill them. And then you can put them in like a baggie and send them away for testing. We don't want to crush them or anything like that because those disease pathogens are inside that tick. So if we squeeze, we might potentially, contaminate or introduce something, like if you had a broken skin on your hand or your finger and you're squeezing and you're squishing, we don't want to, we want to just avoid that contamination. So we just kill them with alcohol, then preserve as much of that body as possible for identification. Like I said earlier, the Asian longhorn tick is identified by its face and those horn structures that it has. So if we destroy those and then we send it for identification, it's kind of harder for them to do. So trying to, keep the tick as whole as possible, but getting it out of you without breaking anything is also really important. So after you dispose of that tick, we always want to wash our hands and the bite area with soap and water. We don't want to use anything like petroleum jelly, Neosporin. I've heard people using matches or nail polish. Other remedies that you might hear, a good old pair of tweezers and pulling it straight up. That's the best route to go for that. So we do have, Ohio State has a website. They're calling it the Bite site. This site has embedded links to reputable partners like the Ohio Department of Health, so that you can be sure that information on vector distribution and case counts are always up to date. You can learn about all types of bugs, insects, diseases, anything out there from ticks to mosquitoes to other biting insects. Excuse me. So the take-homes that we have are tick diseases are preventable diseases. So they are around all 4 seasons. Depending on the data, depending on how many ticks and what everything is being sent in to be identified, we're finding new diseases, new species, new ranges, different counties having established populations that may not have had them in past maps. Need to have a personal plan for your safety. So using those products that I mentioned before, having treated clothing, if you are putting yourself out in these environments on a regular basis, and then just doing regular tick checks. And then knowing that if you do a tick check and you find a tick, knowing how to properly remove that tick and submitting it for testing. I always want to say I do care about you and your livestock. So I always like to throw in how to remove these ticks from us safely as well. And then I just kind of wanted to throw this out here. This is an upcoming program that is going to be held in Muskingum County at Muskingum Livestock. Well, not Muskingum County. Is it? I just got sent this. So it's at Muskingum Livestock. It's going to be on June 16th. Garth Ruff is doing a program on combating tick-borne pathogens in the cow herd. So that should be a nice evening meeting. If anybody has any questions, you can contact the Muskingum OSU Extension. Their phone number is listed here. We try to do programs throughout the state with information as it becomes available to us. And if you ever have any questions about submitting ticks, feel free to email me or call me. OSU Extension, Monroe County, Catelyn Turner, 740-472-0810. I think my email address was at the beginning of the slide, so I don't know if we had any time for questions, if anybody had any.
I do, Caitlin. The cattle insecticide ear tags, mostly for fly control, but the one I use also is for certain ticks, like the Gulf Coast tick. And I was wondering how effective they are with ticks, considering you said that they have to actually, touch the insecticide actually has to touch the tick.
Yeah, so there's ongoing research with those. I'm trying to remember what slide I had more information on that about. Because currently there is nothing labeled for Asian longhorn, but some of those products and some of those ear tags are labeled for other types of ticks. But since it's not labeled for Asian longhorn because there's not been any research on them, but it is being recommended that those will work as well. It's just those ticks crawl up to that area, they brush by those, and that's how they come in contact. But trying to think. Probably didn't answer your question.
I just wondered, it sounds like they are at least partly effective against certain ticks.
Well, I think it's better than nothing. Having something there is better than nothing. But from the things that I have heard, if you work with your cattle on a regular basis and you notice any, we've had a lot of people have great success with those pour-ons. Like that farm I was talking about where the bull had his ear canals full and it actually took him down. They treated the rest of the cattle with a pour-on, and by the time the grad students and me got back there to do tick checks, they were gone. So just kind of follow the label. Yeah, just follow the label.
I just had my whole herd doused about a week ago when the vet was out, so for spring shots. So everybody got poured on.
Good. Yeah, so it's just read the label, trying to see what else we can come up with that is maybe got Asian longhorn on the label, but just make sure that the products that you're using are labeled for ticks. So. But it seems they have more for companion animals than they do for livestock at the time being.
Right. I got 3 dogs. They all take the oral flea tick medication, whatever it is, Advantage, something. I don't know. My wife buys it, but yeah, it works well.
It does. I like that too because it works from the inside out, and that's how the ticks get exposed to it that way. So, and we just need something like that for cattle.
Right. Yeah, something you just sprinkle over the grain and or hay, and they're good to go.
Yep. More data, more information, more research, and we'll be on our way to figuring that out.
That's why we got awesome research university like OSU and Central State providing us extension work.
Yes, exactly.
All right, Catelyn. Well, I don't have any other questions, and I know Sarah had to step off here, but we will be sure that we get this posted to our YouTube channel, and appreciate you joining with us this evening.
Thanks for having me. That was a lot of fun. I liked it.
All right.
Anytime I could talk about ticks.
Maybe we'll head down to Southeast Ohio here in the near future and visit you down there.
Yes. So I want more information on this program you're having at Ears. So maybe I'll see you down there.
Yeah, Dan Lima. You can reach out to him, and he's the one that's trying to coordinate this for us. Okay. I think we're about locked in. And OSU extension educators are going to be doing the presentation. So
sounds good.
All right. Well, you have a great evening.
You too. Thank you.
Thank you. Bye-bye.